Welcome to Rational Politics. I'm Nigel Aves, your host. Today we're going to be talking about the pharmaceutical industry in this country. I have two highly intelligent people with me that are going to help pass on a lot of this information for you. First, let me introduce Ike McCorkle, who's running for the Congress of the United States of America. Ike, welcome back to the table.
Hey, thanks so much for having me. I can't tell you how much I appreciate it. It's great to be back on Rational Politics, Nigel.
And we have got a brand new face today who has joined the table. Isaiah Sandoval, welcome to the CIT network.
Thank you. It's great to be here. I'm excited.
Excellent, excellent. So let's get into the meat of this particular problem. My wife had to have cornea replacement surgery, and she's now going to be on a drug for the rest of her life called Lotemax. Lotemax actually acts as an anti-rejection medicine. In this country, it costs us $300 per bottle. In Canada, it would cost Canadian dollars 90, which works out to about 72 US dollars. In the United Kingdom, we would be paying $12. One of the things that happened in this industry is that the pharmacies discovered that they were being just inundated with paperwork. Instead of actually correcting the issue of the paperwork, they decided, let's invent a middleman that will sit between the pharmaceutical companies and all of the pharmacies, and like that, they can worry about doing just the paperwork. So they invented the Pharmacy Benefit Manager. Boy, doesn't that sound impressive. The problem is, these people are actually costing you $300 billion a year to move stuff from point A to point B. Why don't we start with you, Ike? I know this is a hot topic for yourself. Where do you stand on all of this?
The Pharmacy Benefit Manager does sound like a good idea, Nigel. Like you said, the pharmacies that were, supposed to be distributing medications were inundated with logistics, basically, paperwork. And the insurance companies were also inundated, so they needed a solution, right? And so what started out as a great idea as administrative processing and logistics capacities that are needed turned into something that it shouldn't have. Instead of doing what the original intent of their formation was, and that was to benefit the consumer and push down the cost of prescription medications, instead what happened is what happens in many of our systems. Individuals take advantage of it. And the Pharmacy Benefit Manager over time transformed from a patient driven apparatus that was supposed to push down the costs and for consumers, wound up coming up with schemes to push up the cost of prescription medications. And the reason for doing that is because it turned into a for-profit institution. And when you have a for-profit institution providing a service, the cost slowly and continually goes up and improves the profits of that for-profit institution. And that was never the intent of why the Pharmacy Benefit Manager position or organization came about or was created. It was actually created to the exact opposite reason, when push down costs of medications. Yeah. And so now we're faced with the situation that you described in other countries, for instance, where the middleman, the Pharmacy Benefit Manager, or the apparatus that does the logistics and administration for processing of pharmaceutical medications. Other countries might get $4 out of $100. In the United States, that's closer to $8 to $10. And that equates to $300 billion in profits. And we have the highest healthcare costs in the advanced, Western civilized world. And so we need to address these issues. One, because 60% of annual bankruptcies are caused directly by prescription medication costs, like insulin, for instance, like a lot of people depend on. So the cost of insulin, the cost of these medications, life-saving medications, are being jacked up so that the Pharmacy Benefit Manager can organizations, for-profit organizations, can benefit to exponential factor, and we need
Right.
to bring healthcare, and we need to bring the administrative and the logistical costs back in line with the end state objective, which is patient care.
Right. But there are three PBMs around, or three big PBMs. One CVS, Optimum RX, and Express Script. And these cover over 180 million, I'm going to say patients. That's who they're meant to be helping, except they're not. The other thing that I found interesting was that quite often they will negotiate bonuses with the pharmaceutical companies, but they don't pass the bonuses on. That also goes towards their $300 billion industry.
I want to say one thing about the individual consumer too, purchasing their insulin or any medication for that matter at the pharmacy. There's a copay, and your insurance picks up a portion of it, and you have your copay and you get your medication. Well, what happens when that cost of that medication is actually less than the copay? Oftentimes, what is called clawbacks are used by the pharmacy benefit manager to take that difference in the cost. So if the medication costs less than the copay, then the pharmacy still charges the consumer the full cost. And then the pharmacy benefit manager is able to take the difference back, and that also contributes to those $300 billion in profits. But from my perspective, in a just system, if the cost of the medication is less than the copay, then the patient should be paying $0 for that medication, right? Not paying a pharmacy benefit manager for doing absolutely nothing, right? Because they didn't do any processing in that particular instance, right? And so there are different ways and means that these pharmacy benefit managers have developed to profit off the individual healthcare consumer,
Right.
And that consumer includes our guest here.
Isaiah, you've been sitting here very quietly, but I think it's now time for you to jump in and put your feeling about everything that we've talked about so far.
You keep mentioning how these companies are covering 80% of 180 million people each year. And for these people to become educated, they have to pay, for any report on what these PBMs are doing, they have to pay over $1,800 just to look at the report. And that's still what the PBM wants you to see. And they can decide whether they want you to see it and when they want you to see it. So these PBMs are pretty much kept entirely in secrecy.
Absolutely 100% correct. It'll cost you $1,800 to read that report. That's providing they let you see the report. They even vet you as a person and want to know what you're going to do with that information. And we were honest with them and said, yeah, we're going to use it to rip this industry to shreds. We would never see that report.
And the question is transparency. And transparency in government and transparency in the pharmaceutical industry is non-existent. So I do think that we need some federal disclosure standards for all of our pharmacy benefit managers. Organizations or corporations. I think it's interesting when you talk about organizations or management organizations and whether or not they actually need to be there, because some of the logistics and administrative processing, that it does need to be done. But there are companies out there, Caterpillar, for instance, providing their employees with health care. They didn't like the price gouging that was occurring in the pharmacy benefit manager organizations, and so they decided that they were going to do it on their own. Mm-hmm. And they said, we're going to get a group of doctors and pharmacists and subject matter experts and have them advise us on the formulary and essentially do the administrative job of the pharmacy benefit management organization. And lo and behold, Caterpillar started saving millions of dollars on employee health care. just like in foreign countries where they spend $4 out of 100 instead of $8 out of 100 like we do on administrative and logistical processing fees and costs. There are solution sets when you take the for-profit motivations out of the system. And that's what I want to accomplish in the federal legislative process, is to put in place regulations, to put in place disclosure standards, so that the information that you're talking about, Isaiah, is in the future public source information. Because every individual healthcare consumer and American citizen, in my opinion, should be able to look and see where their dollars are going with respect to what they're spending on their healthcare.
And you mentioned something in just that little talk, the formulary. We should talk into a little bit of what exactly that is. The formulary is something that these pharmacy benefit managers have created. They pretty much pit two drug companies against each other, and they're trying to see which one will give them the better deal, give them more money to put their drug on this list that pharmacies can then give out. So these are also just another way that these PBMs are just taking the money off the top. They're not even taking generally the best drugs in this instance, and just what they can get for the top money, so the most money can go in their pockets.
Yeah, so the formulary is essentially what medicine that your insurance will pay for. When you go in and see a doctor, they give you a prescription for a medication for a condition, and then your insurance company has a list of medications, that's called the formulary, that are approved for use for certain said conditions that your doctors can prescribe. The formulary itself, I think, needs some sort of oversight, federal oversight. So Institute of Health panel, for instance, or committee could evaluate the efficacy of all prescription medications and create a national formulary. And that way, people won't be only placing brand name, high cost medications on the formulary that also benefit their shareholders and their profits, because shareholder profits shouldn't be the objective of a healthcare system. It should be patient care.
Not in this country.
I think I said should be.
And you did say should be, but it's never going to happen. Not when everything is privately owned and they don't care. They don't care about you. They don't care about me. They certainly don't care about Isaiah. This is one of the reasons why I got so angry. That became so obvious.
Yeah. It's obvious to us. It's obvious to CEOs of corporations like Caterpillar.
Yeah.
It's obvious to Walmart. It's obvious to Amazon, who are both corporations exploring, forming their own pharmacy benefit management organizational capacities, so that they don't have to be price gouged by the current system. And so, the real question is like, how do we fix the current situation of where these three major pharmacy benefit management organizations are essentially gouging both the consumer and corporate America.
So, okay, they got to understand this really easily, really quickly. And they renegotiated, they came out on top. So, tell me, why the hell does no one in Washington know this? We heard Trump go on and on and on about how he was going to get drug prices down. We heard that over and over again, and what happened? Absolutely sweet bugger all, to be honest with you.
It's because it's turned into a special interest. A special interest group essentially is some organization or entity. It can be lobbyists, it can be corporations, it can be a group of citizens. They influence the government, and the way that they're influencing it now is with the dollar sign. We have a whole bunch of legislators in the United States Congress who are reelected on a consistent basis because they support the corporations that they support, and those corporations in turn fill their PACs, political action committees, with funding. And so when you have elected representatives accepting 70+% of their money from corporations and from pharmacy benefit management organizations or corporations, they vote to keep that system in place because that's what drives their profits.
Yeah.
Trump even came out emphatically and on the stage and said, we're cutting out the middlemen, get prescription costs down. But just like, Ken Buck is a K Street politician, Trump was this exact same way. They'll say whatever you want to hear, but then when they go vote, it's legislation that benefits the profits of shareholders instead of citizens and patients.
We kept hearing in the past that the reason that drug prices in this country were so high was because they needed the money for research and design. That's where it's all going. Wrong.
Yeah.
They spend 3 times more on advertising, marketing their products than they actually do on R&D. Why do I keep seeing these mega expensive adverts on television? There was one around where they used all the, I don't know if you remember it, all the paper thing, where it would walk through a whole scenery and all done with, it was a very clever advert. But why is it even on television to start with? I don't know whether you guys know this. Actually, I'll ask you, how many countries allow drug advertising on television?
The United States.
Pretty close.
Pretty close.
Yeah.
I know you already know the answer
know this
because
one.
2, America and New Zealand.
New Zealand.
They're the only 2 countries that actually allow drug advertising on television.
To kind of add on to this, the big issue with these advertisements, we don't have issue with getting your name out there. That's not the issue here. The issue is the money that these advertisements are using. That is an insane amount of money coming from the people's pockets. It's not against the advertisement of the drug. It's against why are we paying so much for these people to push a name that we shouldn't even be knowing about? Like, this should be between the doctor and a pharmacy.
These pharmacy benefit managers, these companies, they actually make more money than the pharmaceuticals.
That's absolutely right.
Yeah, they've actually gotten so good at it that they've kind of siphoned profits from pharmaceutical corporations that develop the actual medications and do the research and development. In a just system, research and development and patient care should really be the number one focuses of spending. If it doesn't raise the question of whether or not we need an individual single-payer medical system that is not inundated with these for-profit systems, I think that we need to stand up that public option and start driving down the cost of medications and care, and then we need to have those disclosure and transparency standards at the federal level so that we can get access to those reports so that we can see where our money is going. So that we can start moving as quickly as possible towards the most effective system that's out there, and that is, of course, a single-payer Medicare for all healthcare system.
Right.
And we could get there through a transitional period, just like Vice President Harris talked about, over a 4 to 6 year period. At the federal level, a lot of examination of how we go about ensuring that the logistics and administrative processes are completed and how they're kept in reasonable cost brackets. And there are plenty of foreign governments all over the world that do that. And one of the things we could look at doing is passing a federal standard to state that corporations are only allowed to use a certain amount of their revenue on advertising or none at all. Because in my opinion, just like Isaiah said, prescriptions should be being handed out because a doctor decides that that's the best course of action to take for a patient's health.
Well, how it works in 99% of the world.
Right. Instead of, we're going to prescribe this medication, it's the only one on the formulary, and we're going to prescribe it because, our organization has shares in this pharmacy benefit management organization that provides, the medication.
Right. One thing that's worth remembering, and I'm going to close on this, the US represents approximately 15% of the world's diabetics. But the pharmaceuticals make 50% 80% of their income from those 15% Americans. Thank you so much for watching part 1 of this Rational Politics, and we're talking about the pharmaceutical industry. We'll be back.